Hi, this is Roseanne Fraser, and I'm going to demonstrate how to put on a colostomy bag. Now, there's several reasons why a patient may need a colostomy bag. It could be due to ulcerative colitis, Crohn's disease, diverticulitis, and colorectal cancer. Now, a colostomy or ileostomy is a procedure done by a surgeon where part of the intestine is connected to an opening in the abdomen where the stool will drain out. Nursing care for the colostomy would be to want to check the peristomal area, the skin around the stoma site. You want to make sure it's clean, dry, and intact. There's no breakdown. If there is breakdown, there is a technique that we call the cresting technique to help heal the skin under the colostomy. You want to check the stoma site. It has to be red and moist. It should not be dark or dusky. In the instance it is dark or dusky, you want to let the physician know immediately. That indicates any constricting, or there's some blockage there or some constriction there where the patient is unaware of. You want to check for stoma necrosis, prolapse, or retraction. You also want to assess for infection and constipation. Now, upon discharge, you want to teach the patient about nutrition by eating lean fruits and vegetables, lean meats. You want to stay away from any gassy foods like beans, cabbage, and broccoli, which will cause any type of foul odor. And then you want to stay away from any foods that will give you cramps and watery diarrhea. Okay, so now let's do the technique. Here is my setup. What I'm going to use is the one-piece pouch. There is another pouch called the two-piece pouch, which is a moldable pouch by Convatec, which is pretty easy because you could mold it to the size of the stoma. But for this demonstration, I'm going to use the one piece. So I'm going to wash my hands. This is mimicking hand washing. Mimicking my hand washing. Okay. So I'm going to don my gloves. Sorry, my computer is a little short. So I have my stoma adhesive powder that I'm going to use on the device. I have the Ekin seal. This is to help it seal on, give it a really good seal on the skin to prevent any leakage. I have my skin barrier, which we're going to use in the cresting technique, and my stoma adhesive powder. Alright. And this is my stoma. So first, we're going to wipe off the stoma. Take, for instance, we took off the old bag. We're going to wipe off the stoma. 1 and 2. Now we're going to wash it with some mild soap and water. Because after you wash it with the soap and water, you can better see it and assess it. Now we're going to pat dry. We're going to pat dry the area So now your stoma should be red and moist. There should be no breakdown around the skin. It should be clean, dry, and intact. The peristomal area should be clean, dry, and intact. Like I said before, we're going to use the one piece. So now we're going to measure the stoma. This is the measuring device that comes with the device, the appliance, the ostomy bag. So I'm going to try the 1 5/8 size for the stoma. Now this size is a little bit snug, and I'm worried about constriction, because we don't want constriction because the stoma doesn't have any pain receptors. The stoma doesn't have any pain receptors, so we don't want to use this size. We want to go a size up. But then again, we don't want to go too big because it could promote any fecal matter into the stoma, around the stoma skin, and also extra moisture. So 1 5/8, 1 3/4 seems to be a little better, but I'm gonna measure it on. Yeah, it seems to fit a little bit better. Not too big. So when you measure it on here, it's 45 millimeters. So you want to take a pen and make a marking right here and right here. So at the 45, you want to make a marking. And at 1 3/4, you want to make a marking. Right. See? You always want to go 1/8 up more than the stoma size. So now I'm going to cut it. I'm going to cut it to the size. It's a little bit difficult, but you'll get the hang of it. And once we cut it, and then we fit it on, we'll see how it works. Just follow the guide around. Okay, so now that's going to be our size. Okay, so now what I'm going to do is I'm going to use something called the crusting technique. Now what that is, basically I'm going to put the powder, the stoma adhesive powder. I'm going to sprinkle it around. First, the area is clean. I'm going to sprinkle it around the peristomal area. And then I'm going to take my skin prep and let it just soak up to seal it, to seal the powder. I don't know if you guys can see, it's probably too much light. But to seal the powder, you use the skin prep. This is called crusting, the crusting technique. This is to help give a good seal when the appliance goes on. So we gotta let that dry. We let that dry. Then I'm gonna put the e-conceal, which is also a good seal too for around the stoma. Oh, God. To help seal and prevent any leakage. So in the event that you did have some skin breakdown, this right here, this pressing technique will help heal the skin. Okay. So now we have the cresting technique and the e-conceal. Now I'm going to put on the wafer. Since we already pre-cut it. It should give it a good seal. And you can hold your hand over it for 30 seconds or so. Just the heat and the moisture from your hand and the stoma will help give it a better seal as well. Okay, so good. So now, the seal. So it's on there good. Now with the bag, how you close the bag, since this is a one piece, it's gonna fold upwards, and then it's just gonna Velcro on. And then that's it. So that's how you do a colostomy bag. Thank you.